Hi everyone, if you're joining us for the first time, thank you for joining us for this second panel on Disparities in Access to Healthcare. My name is Dr. William Simmons. I am a psychologist, entrepreneur, and humanitarian. I am also a member of the Child Guidance Resource Center's Board of Directors. Today's event is hosted as a joint effort by Child Guidance Resource Center's Diversity, Equity, and Inclusion Committee or Council and our Government Relations Committee. Child Guidance delivers evidence-based behavioral health services and community-wide wellness programs to children and families across the 5-county Philadelphia region. Families, and in many cases, entire communities as well. This is the scope of our services. Healthcare access should be for everyone, and without access, disparities in health outcomes deepen, perpetuating cycles of poverty and limiting opportunities for individuals to thrive. Child Guidance Resource Centers felt a need to host this event on this particular topic and bring awareness and resources to our community. Today, we present panelists who will share their views on the topic and offer ways to work together for solutions. Our second panel today includes elected officials from around Montgomery County. I would like to go down the aisle here, go down the line, and have each panelist please introduce yourself as well as the organization or your role that you're currently representing. There's a mic. You can all share the mic. There's one right there in the middle.
So this is, it's supposed to be ladies first, but I just want to let the record reflect that they both told me to start. So good afternoon, everybody. My name is Greg Scott. I happen to be the state representative for this community that we're in right now. I represent the communities of Norristown, Conshohocken, and Plymouth Township in the State House. I am in my second term, just started my second term last month. I'm honored to be here to discuss these important topics that we're going to be talking about today, behavioral mental health disparities in communities of color. I want to take a moment to acknowledge the organizers, the event organizers, and say thank you. I know Mr. Jackson is here. He was my 6th grade math teacher, then was my boss when I worked in the Congress, and now I'm happy that he's just my friend. But I still can't call him anything but Mr. Jackson. So really thankful for him putting this panel together, looking forward to having a robust conversation on how we can move the ball forward. So thank you for being here.
Thank you so much, Greg. My name is Maidera Talia Robinson. I am newly appointed to Norristown's Municipal Council, so I am a councilwoman at large for Norristown. That is, like I said, a newer role for me, but I've been of service to my community for many years now, and it's exciting to take a role like that. If you've seen it or had heard of me anywhere else before, I am an artist. I've lived successfully and professionally as an artist for over 20 years now. I'm still young, though, but for over 20 years I've lived professionally as an artist and currently serve as Senior Director of Community Investment at Theater Horizon here in Norristown. Also, too, just to acknowledge all of those who put in hard work for this day. Thank you so much for having me. Appreciate being here. Coach, thank you. I was on the first basketball team that he coached here in the Norristown area. When he coached for us at Eisenhower, he made us dribble in the hallways. Like, it's stuff I'd never seen before. So shout out to you, Coach. Thank you so much. And I appreciate you. And you know you can call me. Put me in any day, Coach. We're here for you. Thank you all.
Thank you. Good afternoon, everyone. Last but not least, I'm Commissioner Jamila Winder. I'm proud to serve as County Commissioner right here in Montgomery County. Proud to have grown up in the Norristown area. I'm a product of Norristown Public Schools. I did not have Coach Jackson. I'm a little older than these guys. But I've been a County Commissioner for about 2 years, but prior to that I was on the East Norriton Board of Supervisors as well as on the Norristown Area School Board. So look forward to a thoughtful discussion, and thank you all for being here.
Thank you so much for being here. Don't we have a wonderful group? All right, let's hear it for our panelists. our topic at hand, and you can answer all or some that you feel more equipped for or more ready for. Either way, the floor is yours. First question, health-related social needs, or HRSNs, are frequently identified as root causes for disparities in healthcare outcome. Do you think we can do more to increase awareness of the impact of these social and economic circumstances on the health of the communities?
So I'll start. We can always do more, I would say, and Montgomery County recognizes that social and economic circumstances such as your income, your access to affordable housing, food security are all fundamental to health outcomes, and increasing awareness of these health-related social needs is crucial to advancing health equity. And we have done a lot of good work in Montgomery County, but we acknowledge the historical and structural inequities within our healthcare system, which have led to a wide range of distrust, mistrust in community of colors. And so we're trying to address that so that we can ensure that breaking down those systemic barriers, ensuring that we have trust, and really invoking policy changes and community engagement. We all know that the COVID-19 pandemic underscored the long-standing inequities that exist in communities of color, certainly higher rates of severe illness and mortality. And so when we think about some of the things that we're doing in Montgomery County to address some of this, at least in the last 2 years, our newly elected administration has really taken some concrete steps to improve some of the social determinants of health. So a few things that we're doing is, first, we have to show leadership as an employer, right? So we have to take care of our employees that are out in communities, really solving some of the challenges that we'll talk about today. And so we've been focused on raising county wages so that our employees have a livable wage. We established the best paid parental leave policy in the entire Commonwealth for a government agency. And we know that when parents have the ability to step away and bring a child into this world, that their children will have, a better support system early on. And then we also have done a lot of work around closing kind of gender and racial wage gaps. So we did a pay equity study. So we know that things like, pay and access to job opportunities affect people's health and well-being. The other thing that I want to mention is our Monco anti-hunger network. We're doing a lot of work around food insecurity. This past year, we created a food policy council to really address food insecurity. And post-pandemic, people are really struggling. People that might not have otherwise struggled to put food on the table. And the last thing that I'll mention is the work that we're doing around affordable housing, right? We know that having housing, when you think about Maslow's hierarchy of needs, housing is a basic element that we just did a point-in-time count. We have over 500 people sleeping on the streets right here in Montgomery County. And so in order for us to address some of the social and economic circumstances that are affecting health in our communities, we have really been focusing on addressing some of those particular issues.
Thank you so much. I think that, you hit on a lot of points, and I'll just speak to the fact that some of this, I think the awareness, we have to elevate in how we approach the awareness factor. You come into moments like this, and I'll speak specifically for myself, right? In preparing for even to be here today, there's this realization of there's so much you don't know. And I would consider myself of the informed on many things. And so when I think about that, I think about the importance of making sure that we are building up the awareness around around these health-related social needs, right? Because these are the root causes as been identified. And many times what we see is the symptoms. We see the impact. We see kind of too little too late, right? We see what's going on and we might mobilize to work on those efforts. But without addressing the root cause, right, we run the risk of this still being something that perpetuates in our community over and over again, even if we address a symptom. The cause or the internal factor is still at play. And so I think it's so important if we've been able to, at this juncture in our lives and as a path, as a community, as legislators, even coming to understand that we have now some names, we have identifiable root causes, all the more is it time to make sure that that information is shared far and wide. This should be like universal language, right? I would love to be in the next context when I come that we all know what these acronyms mean, that this is something that is so actively spoken that it feels like secondary language. Because I think what we do see is that the impact feels secondary. I need this, I don't have access to that. We hear that, we are aware of that, but now that we have identifiable root causes and more information around the studies, the more informed we are, the better we can act. You all have, I've heard the Bible already pulled out today, so I'll just pull my moment just real quickly. But learn to do well, right? When we now have these opportunities where we have learned, it is the obligation now to do well. And so when you ask the question, can we do more to increase the awareness? Absolutely. And it's going to be, in my mind, it has to be pretty creative in how we do that, because you're now being asked to give a point of education to people who are already suffering. And sometimes it's harder to hear when you're already in need to try to chase all the steps backward, because they want to hear solution. We want to hear solution and maybe not actively like breaking down all the causes. So I would be really interested in working with all of us on these levels, and especially those out here, to figure out what are the engaging ways that we can make sure that this information is getting out far and wide, that people are able to recognize and identify it for themselves. And hopefully that also empowers better choice making on our parts, outside of just like the healthcare structures and institutions, but the average individual, when they can understand the root and they can understand the pathway, they too can feel more invested, more informed, and more able to make choices that adjust the outcomes that they want to see. So I definitely agree, increased outcome, and I just really appreciate being here because I'm already learning so much and just being prepared for this moment.
So I just want to level set expectations, right? So sometimes folks that didn't have the pleasure of having Mr. Jackson don't understand how government works. And so I want to make sure that you understand the lens at which I look. So I'm a legislator. I'm a state representative. My job, I have two primary functions. One, create policies and state laws, right? And the second one is to appropriate the state's funds. Last week, Governor Shapiro gave a budget presentation in which he is proposing to spend roughly $50 billion of the state money. He's got to go to a board of 253. To all my executive directors, anyone that's ever worked for the board of directors, imagine having 253 boards of directors on a board. He's got to go to the board of directors, which includes the House. I'm a member of the House, 203 of us, and 50 senators, to get approval on each of those line items, right? And so I come at this as a legislator and as an appropriator. Should we increase awareness was the question? 1,000%. There are 253 members that have a say in $50 billion and how we're going to spend that money. And as you can imagine, we're all A-type personalities with 253 different experiences and 253 different ways that we can spend that money. A little bit about me is I grew up not too far from here in a single-parent household. My mom did her best to raise both my brother and I. But she had some health challenges, and when I was 11 years old, she took me to the doctors, because that's what single moms do. You go to the doctors with your parents, and the doctor said to her that the treatment you need for this ailment isn't covered by your insurance. However, if Hillary Care passes the Congress tonight, it could be covered under Hillary Care. And for those folks out there, Hillary Care was the precursor to Obamacare, Hillary being the First Lady of President Bill Clinton, the 42nd president at the time. And so I went home that night and I watched the news at 11 o'clock, and there was this legal moment happening on the news, and they talked briefly about how Hillary Care failed to pass the Congress, and they spent 30 seconds on that. And then they spent 2 minutes and 30 seconds on Ken Starr and the status of his investigation, right? So I was like, wait, how are we spending more time on what happened below the desk but not spending enough time on what's happening, what should be on his desk? And I wrote a letter to the President of the United States, and I expressed as much. The President wrote me back. We had a conversation at the Philadelphia airport, and then ultimately he landed Marine One at our high school, Norristown High School, where we talked further about these issues. I'm telling you that not to gloat, but to tell you that that's the perspective that I bring to the table when I'm at the board meeting with 252 of my other colleagues, right? And not to disparage anybody else's upbringing, but these issues are what I grew up with. I know what it's like to have a mom focused on everything but herself. I know what those residuals are like. I also have seen what happens when parents have the ability and the access to care for themselves mentally, socially, physically, financially, right? We have to bring a level of awareness for this, because too many of the people that live in the community that I live in are like my mom in this situation. And if we don't rescue them, and rescue them in a thought-provoking manner and work with folks like Jamila, I'm an appropriator and a legislator, she's a project implementer at the county level, and we don't create we don't break up these silos. Too often, so many of these programs are in silos. I applaud Jamila for breaking down the silos in Montgomery County to make sure that different groups are talking to each other. One of the things the government does pretty damn good is funding programs. What they do horribly is making those programs and systems talk to each other, because everybody wants to protect their pot of money. There isn't an incentive to you came in with 25 people on this program of need, you got to reduce it to 5 or 10. There's no incentive to do it. So the counties have got to take the initiative and spend the money on their own, the money that we're not giving them from a state perspective, to break those silos down. But we also have to live our values. So not only are they breaking down the silos in Montgomery County, but they're saying, you know what, we've got to practice what we preach. We've got to make sure that our employees have access to paid parental leave. If you can't take off because your kid is sick, what kind of mental health is that doing? You're focused on your job instead of your child's mental health. So this is a holistic perspective. I think the awareness needs to come at all levels. I think that those listening need to share their stories. We ought not be ashamed of our journeys and how we got to where we are. We should talk more about them, break those barriers down so that people understand real life struggles of everyday people that live these lives. So yes.
Thank you so much. What I'm hearing for the most part is that we're talking about, we mentioned the terminology, and it occurred to me that we didn't describe it or define it, health-related social needs. There's the assumption that everyone knows, but essentially it has to do with socio or social and economic implications or factors that impacts a person's well-being or their health. All right? So when you hear that term again, it's just really talking about those socioeconomic factors that influences a person's health and well-being. I appreciate the perspective both from a framework perspective, but also from a practical perspective. And I think listening to all three of you speak, what became, I guess, illuminated there is that awareness is key because it has real-life implication. It's not just something that's written down in policy, and but the practice piece matters. So we do need to focus on health-related, or bring awareness to health-related social needs. So thank you so much for a comprehensive overview of that. For the sake of being efficient, and for the sake of time, I will ask each member to keep their answers, if they can, to about 2 to 3 minutes as we go through the next few, because I know some individuals have to leave at 3, and we have about 15 minutes to squeeze it all in, okay? All right. Is how are opportunities are there opportunities for the PA Department of Human Services to access government funding, including Medicaid, to address disparities in healthcare access and health-related social needs? Are there opportunities?
Yeah. So one of the most powerful tools to combat healthcare disparities is funding. And I have said to the governor and to the Secretary of Health and Human Services that we must ensure that every available dollar is used in a very strategic way to make sure that we're supporting underserved communities and communities like mine. The governor in his latest budget did do an increase in some of these programs, but most of them are left level funded. And the increases aren't meaningful increases. They're cost, I wouldn't even call them costs of living, quite frankly, increases. But we should be looking at every opportunity to access federal funding. And I think the biggest thing that we've got to also take into account is that the American people spoke this past November, and now we're dealing with a different administration in Washington, D.C. So we're budgeting with monies that we're thinking includes federal dollars, but God only knows what that federal dollar looks like come June 30th, which is our budget deadline. But the reality is that Medicaid is a lifeline for many Pennsylvanians and for folks in my district and across this Commonwealth. And we should be working to expand preventative mental health coverage, especially in communities like mine, where stigma often and lack of access, not just stigma, lack of access prevent people from seeking the care that they are in crisis. But we're also dealing with, we have one of the only federally qualified health centers here in Norristown, and our walk-in appointments went where they were averaging roughly 30 a day to 0 over the last 2 weeks because there were 2 ICE raids outside of our health center where folks going in to seek care and folks leaving from seeking care were getting detained and getting deported for literally seeking health care, right? So what are the impacts that has on our entire system, right? It's not just about, oh, well, they're illegal, so that's what they get what they deserve. Well, no, that's not it. There are people that are still here, and if those people aren't getting the treatment that they need, those illnesses will then spread, right, to the kids. The kids are going to take them to the school. Then we got to shut down a whole school, and then it spread to the district. We got to shut down a whole district. There are also other implications. If we don't take care of folks that are getting treated for their issues, right now, last week were there 2 raids. It's the end of the month. We're now in the beginning of the month, right? People also go to this center to get medication. So if they're not getting their medication because they're afraid that they're going to get deported, then their illness is going to get progressively worse, and it's going to cost us longer. It's going to cost us more in the long run. So, yes, to answer your question, funding must be distributed more equitably and fairly, and we've got to increase it, but there are a lot of factors that are, quite frankly, unprecedented, and we haven't had to deal with these in the last 2 years, but I don't think that we move away from our values, and we know how we have to fix the system. We still have to double down on that. We're just going to figure out where we're going to pull the money.
Your colleague covered it all? Wonderful. All right. Next question. How do healthcare disparities impact children specifically? And are there specific legislation, policy, and funding initiatives to address children's needs?
Okay, so look, I mean, we know that they used to talk about the school to prison pipeline, right? I'm one that believes it's like pre-K. We got to get them early, even in childbirth. I'm really happy that we were strong. I was a strong advocate my first term, looking at Black maternal health. You should not be dying for what should be one of the most joyous days of your life, right? So we put some money to study that issue in the first term, in my first year. The second year, with Governor Shapiro's leadership, along with some of my colleagues in the Pennsylvania Black Maternal Health Caucus, we implemented some stuff. We implemented doula care and implementing the connectivity around those. Now we're giving new mothers toolkits. We're making sure that everybody leaves with a blood pressure cuff, all these other types of diagnostic tools. This year, we have asked the governor, and the governor has accepted to challenge the governor in making sure that we have a healthcare toolkit online and accessible to mothers across the Commonwealth. We have as well doing some initiatives around training for doctors and nurses. All of this starts early, and the earlier you start a problem, the less you have to course correct later. So making the investments early, doubling down early is incredibly important. And it's not just in our healthcare systems. We look at these things in a vacuum, mental health and healthcare solutions or prescriptions. All of this is interconnected, interrelated. We need to make sure that we get kids in school as early as possible. We need to make sure that kids are going to the doctors as early as possible. Our preventive schedules. And again, I'm not trying to go political, but that is also, there's going to be some new thinking around vaccine schedules and all that kind of stuff. I'm happy to think that in Pennsylvania, we're going to hold the line and keep the vaccine schedules and make sure that insurers are paying for that. But this all is going to change. So my message to you all that are listening is you've got to stay engaged. This is not a time to sit on the sidelines. You've got to stay engaged. Make sure you speak up with your experience, your client's experience, because we're going to have a lot of changes and we're going to need your voices. And everybody's stretched thin, right? School counselors or mental health therapists, teachers today. So all of it. The earlier we get folks and have a grounded foundation for our young people, the better off productive citizens. We're building prison off of third grade reading scores. Well, it's hard for a kid to read at home if they don't have heat, if they don't have lights, if mom's getting abused. All of these things are interconnected.
Yeah, I think Representative Scott really covered it so well. I just want to highlight a point connecting that from the earlier panel and just understanding that these implications are trauma. This effect that is happening, whether or not we see it in a physical form, there is an internal process that is happening in a human being to get through this moment, right? And to log this into how they cope, how they move forward. We know at a rising rate, stress is one of the biggest killers amongst adults in the United States and worldwide. And so when we look at now integrating stress at a very young and early age into children's lives that they have to now carry over and compound year upon year, when you think about the type of investment that trauma is putting into the seeds of our children, we're going to see what that looks like when we see our elevated crime rates, when we see the lack of engagements in schools and the engagement when it comes to socializing in a community. The evidence is here that there is such a hard cause of what's happening, and a lot of that is what's happening in the unseen, what's happening in the mind, what's happening in the brain development. That also will carry over to how they appear in the workforce, how they then appear in their social lives, how they then act as parents when it is their time to grow forward. And we also know that trauma, as studies have shown, can be logged and then transferred through DNA, through birth. So now you're kind of putting weight upon weight upon weight, and when we start so early, my gosh, right? The implication is shown step by step by step. And so I just bring that point up to think about this. If we don't address this, if we don't bring this awareness, if we don't do all that we can do on all the levels that we work in, I want you to just imagine with me now a 3-month-old baby. And I want you to imagine putting a 100-pound book bag on his back. It doesn't look right? Those two things don't go together. But that is the type of weight that we're now putting on these children to carry through, and it just gets more and more as they grow and as they develop. But I just wanted to highlight that because their existence doesn't stop just because these hard moments come. And then we want there to be a reality that will fix all of this and then that'll all be over. But the fact is they'll have to continue to carry that through and work that out. And even as we try to figure out these strategies, they will still age. They will still go through it day to day. There will still be processes to face. So I say that to speak to the urgency of the moment, but also to gauge our level of patience and how the process can work. And just lastly, I'll say this this identity of putting so much on children. As a parent, it feels incredibly hard. When I was looking at some information to get prepared for today, I saw a study for Pennsylvania that noted just by zip code they were able to identify, a difference or a disparity in life expectancy. That in some zip codes you were expected to age to 63 years old, but just a street over or just a town over, you could have a life expectancy of 83 years old. We're talking about 20 years difference in a matter of blocks. That's a lot. That's a lot to process. That's a lot to take in. And I don't want to look at my son and be thinking, what street do we need to live on so that I can give you the longest term that you can get? And then how do you weigh that out against his classmates and against everything that we have to do? So when I think about the pressures that are on us, sometimes it feels like pressure to even have this type of knowledge. So I say that to say, I feel like we all got to find a way to cope, even in this understanding, because it's a weight. I feel like a weight is on me today, having now learned into this. How do we carry the weight forward? And I want to just say this. I think it's done through compassion. I think empathy is a beautiful thing where I understand you're going through something, but compassion says, I carry the weight with you. Let me do my part as you take these steps. So I think as we get through this and how we carry these weights, how we get through this and all this heaviness on us, it exemplifies for me that we have to do it together at all levels.
Yeah, the only thing that I would add is, the lens that I look at through my office is as a mother, and oftentimes our elected officials don't have the lived experiences to really help inform how we allocate budget, how do we create policy. And so for me, as a mother of a 4-year-old, I feel very fortunate that my son has access to, abundance of opportunities. But I want every child in Montgomery County to have access to, early childhood education, access to vaccines, access to healthcare providers. And so I use my office as, when we're thinking about programming, we're trying to think about how do we break down those inequities that have existed so that, every child in Montgomery County, regardless of their abilities, has access, to programs and services that help them be their best self. And so, that's nothing really profound, but I think that's an important lens that I look at as I think about, where I prioritize our resources and where do I emphasize, our policy focus.
Thank you so much. Next question. We have 1 minute each. See the angst, I feel the angst. What public policies could reduce stress-related, what public policies could reduce stress-related, this question is interesting, resource scarcity, and its potential link to mental health challenges and suicide prevention. So essentially, public policy-related issues that addresses mental health-related challenges, including suicidality or including suicide behavior.
So 1 minute is hard. This is an area that's deeply personal to me. So, I take everything with the lens of lived experiences. So I have a brother that is dual diagnosis, has suffered from substance use and mental health for the better part of 15 years. And so I'll tell you one tangible thing that we did this last year to really, address the mental health crisis that exists in our country, in our county. I'm already at my minute, I think. I'm already at my minute. But health systems across Montgomery County are shutting down, their behavioral health units, right? And so when families are in crisis, so if you have, a sister or brother or child that is going through a mental health crisis, they really don't necessarily have anywhere to go. So oftentimes they land in the emergency room. We've invested $18 million in building the first behavioral health crisis center in Montgomery County. And that will open later this year. So that's a real tangible policy area that we've focused on, and we're putting real dollars to solve, an issue that we know. The other thing I'll say, going to the next, the last question is, we're going to have 5 pediatric beds in that crisis center. And so I heard when I was running for office that that was a major, major issue, is where could parents take their children that were having a mental health crisis. It's sad that our kids at such a young age are dealing with mental health and behavioral health. Now the parents will have a place to take their children. So I'm really proud of that work. That will launch later this year.
So I don't think we can talk about mental health without acknowledging the immense stress that comes from the financial and resource scarcity that many of the families that I represent face on a day-to-day basis, living paycheck to paycheck, struggling to afford rent, worrying about how they're going to put food on the table. These are daily realities for a lot of the folks that I talk to and that I represent, and it takes a severe toll on their mental health. And so stress-related financial instability is a major contributor to anxiety, depression, and even suicidal behavior. And so we need public policies that proactively reduce this financial burden on families. I'm working on policies that expand access to affordable housing programs, taking a lot of input from Jamila Winder. We had a homes program, Homes for All program that the county is spearheading. We also had a program that helps people stay in their homes by fixing up their homes. Hopefully that gets through the legislature again this year. We did it 2 years ago under Nikhil Saval. It didn't get funded last year. We're going to bring that back, hopefully. But we got to strengthen our safety net programs like SNAP benefits and LIHEAP to make sure that we ensure that no one goes hungry or struggles during these winter months. We've got to raise the minimum wage. It makes no sense that everyone around us is, above $7.25 where we're at. We've got to raise the minimum wage. We're far too long to be doing that. So I would say that mental health is not just a medical issue, but it's an economic and social issue as well. And I know I got 1 minute, but I do want to say that we've got to. I mentioned that the school counselors are stretched thin. I just was at a school counselor talking to one recently, and the problems that they're having with these kids are really different than when I was growing up. We've got this social media situation going on, and so we've got to make sure that we expand our school-based mental health programs, and we've also got to attack the insurance companies when they are working on lining their pockets instead of providing the coverage that they need for their kids. We had a program where we are putting mental health providers in schools, and there's this quirky rule in the health insurers contract that says that they will only provide coverage for care that's within the four walls of their approved centers, which means that the mental health providers that we're paying for in the schools, when they go to submit a bill for them, they're denying those claims. It's bullshit. We're going to attack it this year. We're going to make sure that we close that loophole, because we've made a commitment to treat mental health as seriously as physical health, and I'm on the insurance committee, so I can say this. We're taking aggressive action to deliver mental health parity. I've traveled to Denver, Colorado recently with NAIC to talk about our model, and it's going to be a national model. What we've done in Pennsylvania is a national model across this country in terms of investing in mental health, over $200 million thus far. And so we got to make sure that the insurance companies keep up pace with the reality that they're doing. And the one last thing I'll say is that the other policy initiative that we can work on is around our maternal health, and I keep coming back to maternal health because it's incredibly important. And postpartum depression affects more than 1 in 8 moms across the country. And so working with healthcare providers and Penn is doing a great program, a good study around our maternal mortality health and specifically postpartum and other issues is incredibly important, and one of the ways that we can get public policy and infusing it into everyday life.
Thank you. All right, I've been given we have 1 minute? All right, 1 minute. Very quickly, if there is, not your 1 minute, but Luana's 1 minute, which is an actual 1 minute. Final question, because I know you put a lot of thought into this and all of that. How can state, counties, and nonprofit organizations partner to help reduce healthcare disparities? If there's one tool or one thing that you can say about that, how could we make that possible?
I come from the nonprofit sector, so I would definitely say partnership and collaboration are the key to that. Care can look like a lot of things, and it should really be a holistic approach. Care is not only received in the doctor's office, but it is a multifaceted thing that needs to take place at in an organic kind of community setting. So coming from the arts, I will say this, and this is 100% truth, art saved my life. Art got me through some very hard times and even processed very, very hard things. It is the thing that gets me to the other side. If not for art, I'm not here today, and I don't know that there's necessarily a doctor's office that I stepped in that gave me that, but it was the emotional coping that I was able to get through art. And so I'll just highlight that as a community, specifically in Norristown, and even historically in Montgomery County, we are rich in art and in expression. Art has been proven when integrated into medical treatment as well as a part of the life to affect the person at all levels. It can help cognitively, it can help physically, it addresses some core responses within mental illness. So I would just encourage you to look holistically at the term of care, and nonprofits for sure are offering at a high level, whether there's a nonprofit that offers nutritional food, and then there's a nonprofit that offers dance, and then there's another nonprofit that might have some type of alternative services or a mentorship or someone you can speak to. Care has to be a collective work, and I think that is a strong place where nonprofit collaboration and partnership can go hand in hand.
We got the Pete videographer taping this, so I know I'm going to exceed my 1 minute, but it's okay. It's going to make me look really good. But I would say that no single entity, whether it's state government, county government, or local government, which is represented on this platform today, can tackle these healthcare disparities alone. We need collaboration amongst each other at every single level. We need to work with each other. Providers need to work with each other, with school districts and folks that are non-governmental organizations. But we've got to be working hand in hand, not only just together, but also with healthcare providers to make sure that we're delivering a network of support. And that means that we've got to invest in our community-based model, healthcare, mental health, nonprofits, arts, sports, to get people where they are. We've got to encourage from a state level public-private partnerships to bring additional funding and resources to communities like ours, expanding telehealth services to meet people exactly where they are. And we also have to listen to the voices. I think oftentimes you have people in the room making decisions for the folks that they know or read about on TV without talking to them. And I think that the people closest to the pain should also be at the table solving the problem. And so I'm committed to making sure that those voices are directly listened to. And in closing, I'll just say that the challenges that we face with behavioral and mental health disparities in our communities, they certainly are significant. And there are unique challenges today given the circumstances that we have, but I'm confident that they're not insurmountable. We can tackle these things. These are things that are within our grasp, and with the right policies, the right funding, and the commitment to equity, right? Commitment to equity, access, we can create a healthcare system or reimagine a healthcare system that works for everyone, not just those with privilege or access or means. And I'm committed to working alongside my colleagues, not only here, but my 252 board members in Harrisburg and our governor, Josh Shapiro, to deliver a government that works for working class people for real. Thank you for allowing me to be here today.
I'll do just very quickly a wrap up. I agree that it takes partnership, right? We've got to set the egos aside. This is my patch of dirt. This is my organization. That was one of the first things that I learned when I came on board to the county, is that kind of everyone's marching to their own music, right? Trying to solve similar issues. And so, the thing that I've committed to doing is using the power of convening and bringing people together to solve complex issues. And convening power brings about change, brings about resources in terms of dollars and cents. And the last thing I'll say is hold your elected officials accountable. It takes courage to make some of the decisions that we need to make. It takes courage to challenge the status quo, and elections matter. And so we're tackling some very complex issues together. But when we think about like the social determinants of health, this panel right here, we're working. We were just at a meeting the other day to try and solve the homelessness issue in Norristown. And this is the first time that that's happened, across, local government. And so I'm just happy to be here today. I'm happy to play a small part, in making our county just a little bit better for our friends and neighbors. And but it's going to take all of us to solve some of the complex issues that we talked about today. But thank you.
Or questions in such a thoughtful way. We really appreciate your time, and I'd like to thank you all for attending. I know it wasn't easy with the cold and the potential snow, but here we are. It speaks to your commitment. So thank you so much for all that you have done so far, and I hope that this helps us understand how healthcare disparities impact not just some, but all of us, and that we can all work together for better solutions.